The 2009 Fine Award for Teamwork Excellence. Silver winner, UPMC St. Margaret. Beyond the bedside, reducing 30-day COPD readmissions.
Hey, how are ya?
Oh, not too good.
Back so soon, I just discharged you 2 weeks ago.
Yeah, I know. It's pretty frustrating.
This is a group of people we're not doing a lot with. They have some unique problems. They come back frequently, especially when there's respiratory illnesses in the community.
Nice deep breath.
St. Margaret's, when they looked at the rates, also saw that the rates here were fairly high for readmissions, getting closer to 20% within 30 days of the initial admission. So the goal was to try and reduce that and see what it did for patients' quality of lives as well as the cost of care. And it really was getting the nurses involved, the physical therapist, the pharmacy department, the respiratory department, our subspecialist, our pulmonary subspecialist, as well as the primary care doctors, and then case management, which is another separate section of nursing function, and social work if necessary. It's not talking about different resources, but it's realigning those resources to be disease-based. So instead of having someone sit on 5B, they could be focused on the disease process and those individual patients. Because they're case managers and they're nurses, they know how to take care of the patient as a whole.
I had an opportunity to identify a reoccurring patient for COPD. I'm really pleased that we have the COPD order set. I have the discharge COPD list that's on his chart here. I've also initiated the documentation on the e-record where we notify all the disciplines through this task drive on the computer. That's going to include PT, physical therapy, occupational therapy. The dietary staff is also going to be involved in patients' care. Course nursing, COPD care manager is also going to be alerted, and I will be conferring with her.
We want to make sure this patient has coordinated follow-up care as an outpatient. Respiratory therapy knows we're going to use a consistent process of educating the patient.
We go over some of this education, and then we're going to do the smoking program with you. It'll take about a half hour.
We're going to teach how to use these inhalers.
Open until it clicks. Lift it up like you're holding that's like a sandwich. Engage your medication by pushing that lever with your thumb. Put it up to your lips and take a big deep breath in. Take it out. Very good. Hold it, hold it, hold it. Let your breath out. Okay.
When physical therapy comes to see the patient, they say, right in here in your brochure, this is what we're going to talk about in terms of teaching you how to breathe correctly. Isabel has a set of tools for her home interview, which have been developed for the process.
Hi, Mr. Smith. I'm Isabel from the COPD Case Management Program.
Hi.
I spoke with you on the phone, and I just wanted to confirm with you that I'll be out to see you on Wednesday around 3 or so, like we talked about. And I wanted to make sure that you know you can take this inhaler home with you for use until you get your script filled at your pharmacy.
Yeah, that's new. I never had that before.
Right. It's labeled for outpatient use, and we just wanted to make sure that you know, patients have everything that they need when they leave the hospital that they're going to need at home.
These kind of projects just give you the opportunity to step back and say, you know, what is the goal again, and get out of the tasks that we have and go look at what could we do differently, how could we work together in a different way that might make us get to the point we wanted to in the first place.